Listening to your body warning signs you should never ignore. Even with a safe and thoughtful routine, there's one skill every senior must develop above all others: learning to listen to your body. Because the truth is, your body always speaks. The question is, are you listening? As we age, the signals become quieter, subtler, but also more serious. What may have once been brushed off as just being tired could now be your heart asking for help. Let's go through the most important warning signs to watch for during or after exercise. 1. Shortness of breath that feels unusual. It's normal to breathe a little harder during movement, but if you're gasping, struggling to speak in full sentences, or feel breathless even at a slow pace stop, this could be a sign of restricted blood flow, irregular heart rhythm, or early signs of heart failure. 2. Sudden dizziness or lightheadedness. This isn't just about balance, it's often about blood pressure. If you feel the room spinning, your knees go weak, or you need to sit down quickly, your body is protecting you from a fall or a cardiovascular event. Always respect that moment. 3. Chest discomfort, tightness, or pressure. It doesn't always feel like sharp pain. Sometimes it's a heavy weight, a squeezing in the chest, or a strange pressure that travels to the shoulders, arms, or jaw. These can be early signs of angina or even a heart attack. Never try to push through it. 4. Irregular or racing heartbeat. If your heart suddenly pounds hard, flutters, or feels like it skips a beat, especially if it happens more than once, pause immediately. Sit. Breathe. Take your pulse. If it doesn't settle quickly, call your doctor. Arrhythmias are common in seniors, but should never be ignored. 5. Excessive fatigue that lasts for hours. Exercise should leave you feeling slightly tired, but refreshed, not drained. If you're so fatigued that you need to nap for hours, or you still feel exhausted the next day, you may be doing too much. The heart is telling you it hasn't fully recovered. 6. Pain in the legs or calves while walking. Cramping or aching in the legs during light walking can be a sign of poor circulation or peripheral artery disease. It's not just sore muscles, it's a message that the blood isn't flowing as it should. So what should you do when these signs show up? Stop, sit, breathe, take stock, drink water, check your pulse, pay attention to how quickly your body calms down, and don't hesitate to call your healthcare provider even if it turns out to be nothing. It's better to be safe than sorry. There's no shame in taking a break. In fact, it's one of the most heart-smart things you can do. Because the strongest people aren't the ones who push through pain, they're the ones who listen to their limits and adjust with care. In the next section, we'll talk about how emotional stress affects the heart and how movement, done right, can actually become a powerful way to release fear, anxiety, and tension from your life. Emotional stress and the heart. Why movement must also heal the mind. Not all strain on the heart comes from physical effort. For many people over 60, the heaviest pressure isn't what they lift or walk through, it's what they carry inside. Fear, loss, loneliness, and the quiet burden of uncertainty. And make no mistake, your heart feels every one of those things. Emotional stress isn't just a mental weight. It triggers real biological responses. Your heart rate increases, your blood vessels constrict, your blood pressure rises, and your breathing changes. Over time, repeated emotional strain contributes to heart disease just as clearly as poor diet or lack of exercise. So what does that mean for movement? It means your routine shouldn't only build strength, it should offer relief. It should give your nervous system a chance to reset. It should support your emotional well-being, not just your cardiovascular endurance. That's why calm movement is so powerful. Not slow out of weakness, but slow by choice. Movement that's intentional, breath connected, and emotionally grounded. Let's talk about a few practices that calm both the body and the mind, while still nurturing heart health. 1. Deep breathing with gentle motion. Even 5 minutes of moving your arms slowly in rhythm with deep breaths can regulate your nervous system. Try lifting your arms while inhaling, then lowering them slowly as you exhale. Repeat with calm focus. This lowers stress hormones and supports heart rate variability, a key measure of cardiovascular resilience. 2. Tai Chi and Qigong. These slow, flowing movements are often called meditation in motion. They reduce anxiety, improve balance, and are proven to lower blood pressure. Best of all, they require no equipment and can be done anywhere, even in small indoor spaces. 3. Nature walks without headphones. Walking outdoors, with nothing in your ears but the sound of birds, wind, or your own breath, has a powerful calming effect. Natural surroundings lower cortisol and reduce mental clutter. It's not just movement, it's a return to yourself. 4. Seated meditation with postural awareness. Sit tall. Breathe slow. Feel your spine align. Even without moving your limbs, the simple act of stillness, when paired with deep breathing, gives the heart space to rest. Your muscles soften, your thoughts slow, and your pulse finds a calmer rhythm. You don't have to run from stress. You can move through it with care, with breath, and without judgment. And when you do, something beautiful happens. Your heart learns not only to endure, but to release. So let your next workout begin not with effort, but with gratitude. Gratitude for breath, for stillness, for a body that still shows up for you even in your quietest seasons. In the next part, we'll shift from what you do alone to how your environment and relationships can shape your heart health, because no movement plan is complete without community. The heart's surroundings, why where you are, matters just as much as what you do. You can stretch, you can walk, you can breathe deeply, and follow every safe movement plan. But if your environment is full of tension, noise, or isolation, your heart still suffers. Because heart health isn't shaped by exercise alone, it's shaped by everything around you. For people over 60, the world often grows quieter. Sometimes, to quiet, social circles change. The pace slows down, but stress can still linger, not in loud events, but in the quiet spaces where loneliness, clutter, or overstimulation live. And your heart, it notices. Let's look at how your surroundings, your space, your relationships, your daily atmosphere can directly affect heart health. 1. Create a peaceful place to move. You don't need a home gym, just a clean, quiet spot with enough room to stretch or walk in place. Add a chair, a soft mat, maybe a plant or a window view. Calm spaces calm the nervous system, and a calm nervous system means a healthier heart. 2. Move with people who respect your pace. Avoid fitness groups that rush or compete. Whether it's a walking partner, a class, or a friend on the phone, the best support comes from people who understand your rhythm. Encouragement shouldn't feel like pressure. 3. Build simple daily rituals. If you live alone, quiet structure matters. Try light stretching after waking, a walk before lunch, a moment of stillness before bed. Routine brings comfort, and comfort lowers stress hormones that wear the heart down over time. 4. Stay gently connected. You don't need a crowd, but a weekly call, a neighborly chat, or a small class can make a big difference. Studies show that even minimal social interaction improves heart rate stability and reduces risk of cardiovascular decline in seniors. 5. Remove excess noise and clutter. A TV that's always on, loud news, a crowded, messy space. These stress the senses without you realizing it. Turn down the noise. Let quiet in. Clear what you don't need. Make space not just in the room, but in your mind. Remember, your heart doesn't only react to exercise. It reacts to your atmosphere, the sounds, the energy, the tension or peace in the room. So let your home, your friendships, and your routine support the same goal your workout does: healing, balance, and ease. In the next part, we'll explore the powerful connection between movement and meals and how timing your exercise around what you eat can help protect your heart and improve recovery.